We are here today to teach you how to obtain a blood pressure. First, we must introduce a blood pressure cuff. There are different parts of the blood pressure cuff. First, there is the bladder of the cuff. This is what inflates when pumping the cuff up. On the cuff, there will be lines to indicate where the cuff should be placed on the arm to line up with the brachial artery. When applying the cuff to the arm, make sure it fits snug so that it's not able to be pulled down or where it falls down the arm. Next is the bulb and the valve of the blood pressure cuff. The bulb is squeezed to pump up the blood pressure cuff. The valve on it is used to hold air in and also to release it. Next is the gauge. Next, you need a stethoscope. A stethoscope is used to listen to the sounds inside the body. There are different parts to the stethoscope. First, you have the earpieces. When placing the earpieces in your ear, point the earpieces towards the nose. Next, you have the tubing. Following that, you have what's called the diaphragm. This is the side you use to listen to the sounds in the body. On some stethoscopes, there are two sides. The opposite side of the diaphragm is called the bell. Make sure you place a finger on either side of the bell when you listen with the stethoscope. It's important that you do not use your thumb to hold it in place because your thumb has a pulse in it. Make sure you tap the diaphragm lightly to make sure you're using the right side. To obtain a blood pressure, the first thing you need to do is place the diaphragm on the stethoscope over the brachial artery, which is located on the inner elbow. Next, you will pump the cuff up approximately to 180. You will then release the valve slowly to deflate the blood pressure cuff, and while doing that, you're watching the gauge for what number the gauge is on when you hear the first thump. That first thump is the systolic number, which is the pressure created when the heart contracts and forces blood out and into the arteries. While closely listening and watching the gauge, you will then listen for the last thump you hear, and that will be your diastolic number, which is when the heart is relaxed and flow is regular. The normal systolic blood pressure for an adult is 120. The normal range for the systolic for a child is their age times 2 plus 80. The normal for the diastolic number for the average adult is 80. You have now learned how to take a blood pressure.